Yeah.
Okay. Like to call the House Health Committee to order. Will the clerk please take the roll?
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant, Hakeem, Hall,
Here.
Helton, Hicks, Jernigan, Kumar, Marsh, Mitchell, Ramsey, Sherrill, Smith, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
Here.
Mr. Chairman, you have a quorum.
All right, thank you. Before we get started today, do we have any members with any personal orders? Okay, seeing none, we have a pretty robust calendar here. Going to start off with item number 1, House Bill 1163 by Leader Lamberth. You are recognized. You have a motion and a second. And
Thank you, Mr. Chairman. And
Yes.
there is an amendment
Amendment.
coded.
okay, 004595, is that correct?
Yes, sir, Mr.
Okay.
Chairman.
You have a motion and a second on the amendment. You're recognized.
Thank you, Mr. Chairman. This amendment rewrites the bill and makes the bill, and it just makes it clear that a county board of health does, they do not have the authority to regulate agriculture.
Any questions on the amendment? Okay. Seeing none, we are voting on amendment 004595. All those in favor say aye. Opposed? Ayes have it. We are back on House Bill 1163 as amended. Any questions on the bill? Seeing none, we're going to vote on House Bill 1163 as amended. All those in favor say aye. Opposed? Ayes have it. Bill moves on to calendar and rules.
Thank you, Mr. Chairman and members of the committee.
That brings us to item number 2 on the bill is House Bill 768, and I believe Representative Chairman Littleton was okay. She has asked us to roll that to the Hill. So without objection, we are rolling House Bill 768 to the Hill. That brings us to item number 3, House Bill 598. Do you have a motion and a second? Chairman Hazelwood, you're recognized.
Thank you, Mr. Chairman. There is an amendment on this bill. I'm not sure if it's traveling with it or if we need to add it here.
It is amendment number 003767. Is that correct?
That's correct.
Okay. Can I get a motion and a second? Okay, you have a motion and a second on the amendment. Any discussion on the amendment? Okay. Seeing none, let's go ahead and vote and get that amendment on the bill. So all those in favor of amendment 003767 say aye. Opposed? Okay. Ayes have it. We are back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. This bill would simply establish a child care task force for our state. I think it's no secret to anyone how difficult child care, finding quality child care at an affordable price, having access to that child care. It was already an issue in our state prior to COVID, and that certainly just exacerbated the problem. So this legislation would create a task force that would address the challenge of child care. It would look holistically at this problem and try to use all of the public resources, bring them to bear so that we are working, coordinating those resources to make sure that we're utilizing the dollars most efficiently. And building public-private partnerships, I think that's another area that we really need to focus on. We have employers who it's important for them to have their employees come to work, so maybe we can partner with them to help either provide child care on site or help subsidize child care for those employees. I think there are a lot of creative things that we can do. And then we can also, within our state, streamline the coordination of child care among our departments. And I think again, that's something that we all would recognize is an opportunity for improvement. The task force would have the responsibility to develop a strategic action plan that would ultimately increase the availability of high-quality, affordable, and accessible childcare in the state. And the task force would also have the ability to hire and oversee a strategic consulting firm just to support the development of the plan and the gathering of the data and the information that would be used, that the task force would find necessary to develop that plan. And the task force would have a work product. We would have an end result. The work product would provide findings and conclusions about childcare needs, what those needs are, and a strategic action plan of how those needs can be met, and recommendations for whatever legislation might be needed to implement the strategic plan. I think it's important to note, too, that this task force would sunset December 31st, 2022. This is not an ongoing issue. So with that, thank you, Representative Jernigan.
Okay. Seeing no objection, we will be voting on House Bill 598. All those in favor say aye. Opposed? Ayes have it. The bill moves on to government operations.
Thank you, Mr. Chairman. Thank you, committee.
That brings us to item number 4, House Bill 502. Chairman Rudd, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman. This legislation, I guess you could call it, it's been a 4-year journey and a labor of love for me, working with every conceivable person I could on all sides, including mental health judges, advocates, the Department of Mental Health. Legislation is aimed at putting another tool in judges' toolbox that they don't have currently, is for those people who have been repeatedly threatening to kill other people, not harm oneself or harm others, but kill other people repeatedly. And those who are threatening an act of mass violence like a bombing to kill other people or could result in killing other people. Right now, legal authorities have little recourse in Tennessee to do anything except through a very expensive and lengthy process. It could take over 1.5 years. This is also the story in other states where people have committed mass acts of violence, whether it be at schools or other facilities or even the attempted assassination of a congressman. And the immediate family members and co-workers in most of these situations have reported that individuals were threatening to harm and kill other people repeatedly. They went to law enforcement and they couldn't do anything until they've committed an act of violence. This is aimed at if the immediate family member or law enforcement has evaluated a situation in which people are repeatedly threatening to kill other people, they can file a petition with a mental health court judge in 14 counties. Hopefully, if this works out and we work out any kinks, it can be expanded to protect every county in Tennessee. These mental health court judges can then require a person, and privacy will be maintained away from the public so no one's reputation is hurt. They could evaluate from the immediate family members and the police whether that person needs to be evaluated by a psychiatrist to see if they need to be treated. And if they do need to be treated or analyzed, that they can be productive members of society and be safe to everyone. We've got to do something to avoid these mass shootings and mass bombings, and even people that wanted to harm people could be in a car through a crowd. We've got to do something with people that desperately need help. And these people very, very rarely will seek help themselves, and they can't be forced into treatment or therapy at this time without, like I said, a lengthy legal process. And they usually resist treatment and resist any effort to help them. And this is being brought to protect the public and to protect the individual so they can be productive citizens. And with that, and again, this only applies to the 14 mental health counties. This is the same bill that I bought last year that was voted out of committee, subcommittee, and then the pandemic shortened our term and it was not able to go through. The only thing that's been added this year versus last year when we discussed the bill was after the Nashville bombing, I included a provision of threatening and a mass act of violence so that that person could be awarded too. And in that instance, when the person's lawyer and girlfriend told police that they were making a bomb with bad intentions, the police said they couldn't do nothing because they couldn't see the bomb. In this case, they actually can now investigate that further. So that was the intent of the bill. And again, I've been working on it for 4 years, and we finally have it in a form where I think it will pass muster and it will protect society. With that, open to questions.
Leader Gant, you recognize?
Thank you, Mr. Chairman, and I'm sorry I had to be at another committee and I walked in halfway through your presentation. So what this is, has the patient been charged with anything at this point?
No, what
Right,
this
you
was, I'm sorry, what this is aimed at is currently we can't do anything in Tennessee without a lengthy legal process. What this would do if a person is repeatedly threatening to kill other people or threatening, such as a bombing, a mass act of violence, the immediate family members or police can petition a mental health court judge to have them evaluated if the judge seems appropriate, to see if they are schizophrenic or they need to be on medication or they just need treatment and counseling. Or the judge could just simply say this is a local, neighborhood, or domestic dispute and dismiss the case. But that will be up to this trained mental health court judge to evaluate.
Leader Gant?
Okay, so is that a process that we have in current law now?
No.
So this is creating that process?
Yes. Currently, the judges can only police can only arrest a person and charge them after they've committed a crime. They can go and talk to them if they've threatened somebody, but there's not much action they can do unless they admit to the police officer they're going to go around killing people. So this is just trying to get them into treatment so they can be productive citizens.
Leader Gant?
Okay, so help me understand who initiates this process?
An immediate family member and the police officer investigating the complaint.
Okay, thank you, Mr. Chairman.
Representative Jernigan, you recognize?
Sure. Is that me? Yes. Okay, thank you. Thank you, sponsor. I guess I received a letter like everybody else did from 7 different organizations based here in Tennessee. And with the Tennessee Disability Coalition and Disability Rights Tennessee puts it on my radar, then I take pause and I look at it. They've listed 9 different things here. And I guess my question to you is has there been a Tennessee-based mental health organization that is in support of this bill that you know of?
You recognize?
Well, first of all, I never heard of any of these organizations before Monday when I got their email when I arrived in the office. None of them have been in my office or contacted me before this week or Friday after hours when they sent me an email or left me a message on the office phone, which we had already left the office. I have had Tennessee mental health advocates and national health advocates in my office, either supportive of the last 3 to 4 years I've been working on this with legal and with the state mental health department. I have, at that point last year, everyone was either deferred or in support of the legislation.
What do you think has changed? I'm curious because these are, the Mental Health Association, these are Tennessee-based. So they have not reached out to you. Did you reach out to them?
Representative Rudd?
No.
Okay.
I can only assume, Representative Jernigan, that most people over the years that I've dealt with and talked to that are in the mental health advocates, they are strong believers, which is why we don't have mental health hospitals much anymore, except for the violent convicted criminal. They believe in halfway houses and community houses. They don't believe in any hospitals or treatment like that. That's why we don't have many anymore. They've gone to a different approach where they believe in volunteer, a softer approach. This is different than dealing with the mentally ill. This is the violent mentally ill who have actually spoken that they repeatedly want to kill other people.
Well,
You recognize?
this may not be on the bill. I think the reason they go to these different homes, community homes, because you can't segregate people in one area and then leave them there. That's not right. So yes, that violates federal law, and that's why we shut down Arlington and Clover Bottom and Greenville. We shut those down because they have a right to be in the community like everyone else. But I think that's not really on the bill, but that's why we send those homes there. I don't think it's a soft approach. I think it's a humane approach. Okay, this is concerning to me that they do this, that this letter is out here, and I've read through them. But I just wanted to ask you the question to see if there's the process in which you went in talking to these folks. Thank you very much.
Chairman Ramsey, you recognize?
And thank you, Mr. Chairman, and thank you, Mr. Sponsor. As you can see, I signed on to this bill, and I kept seeing these notations come in from the Behavioral Health Foundation, and I kind of wondered at the time. I thought we were on very solid ground, but they raised some specters, and the other 6 folks that came in, and a couple of them actually have lobbyists up here, so I don't know why they haven't contacted you. But their big concern was the forcing of citizens into treatment. Of course, we've made, for the past 30 years, we've been trying to improve the public image of treating mental illness. We've made great investments to decriminalize the mental illness status and create new and pathways that that don't force individuals and with mental health into the justice system inappropriately. The bill has indicated that they indicated to me that the bill is redundant because the intent can already be achieved without adding restrictions on civil liberties. The code allows for involuntary inpatient commitment, 336501, and mandatory outpatient treatments when necessarily due to likelihood of serious harm. And the family members can even now initiate that by requesting a conservatorship. This actually does force citizens into treatment, which can include involuntary injections with side effects and without even a criminal charge or certificate of need. And the question that they've asked me to ask is, since Tennessee already has the mandatory outpatient treatment program and involuntary mental health commitment statute in the state of Tennessee, why do we need this bill?
Chairman,
Well,
Rhodes,
their information is incorrect. First of all, as I said earlier, most likely someone who is possibly disturbed or schizophrenic and threatening to kill other people repeatedly is not going to volunteer and walk into a clinic and seek help in all likelihood. Also, as I said earlier, the process for a family member to do it now is a very complicated and lengthy process at their expense. It is not easy to get someone into forced treatment now. As you can tell by the fiscal note, it's a very low fiscal note of $500,000 and $800,000 a year, which is down from substantially down from when we originally started drafting this 4 years ago. They're not estimating that many people would be that would even come under this program. The advocates you're talking about also criticize the Department of Mental Health 2 pilot programs. I believe they're talking about the one in Knoxville and the one in Hamilton County, that they only had one person go through the system. If one person went through the system and was helped, and I don't know the circumstance of that one or those 2 pilot programs and only one person, that's kind of further proof that there's in all likelihood not going to be a lot of people going through this. If one person is forced into treatment, that could avoid a mass shooting where hundreds of people are killed, or someone in a car at a concert driving through a crowd. We've got to do something to protect ourselves and protect our constituents and our neighbors, and that law is not currently in this state. It is extremely cumbersome, very expensive, and very hard for a family member or a law enforcement to have someone forcibly evaluated. And in all likelihood, if someone is in court and they're forced to be evaluated by trained psychologists, in all likelihood, I think there's a very good chance that those people will volunteer to go into treatment once you've got them help or forced the possibility of help on them. There's already existing state laws that protect people against fraud, like someone wanting to seize an estate of the mentally ill or disabled. Those laws are already in existence. I did not address it in this bill because they're already in existence now for filing false forms, false reports, et cetera. They could be punished for that. That would cover this as well.
Chairman Ramsey.
And that's a good explanation. I guess one thing that kind of chills me about the bill, I do have the greatest respect for recovery courts that we have in our communities, and I've done everything I can to help those. But those folks volunteer, and so I guess this is kind of a chilling effect to think that these folks are going to be put in a position to defend themselves. So, any answer to that?
You recognize.
I was contacted by one of the mental health judges that advised on writing this bill, that advised me on it, that I've been working with. And they organization you're talking about sent the recovery courts a letter as well. This does not concern the recovery courts, and they would not be impacted by this. This would be handled by the mental health courts.
Chairman Ramsey.
No further questions.
Chairman Vaughn, you recognize.
Thank you, Mr. Chairman. And to the bill sponsor, was this modeled after any other state's legislation that you've come across, or is this a brand new concept being hatched here?
Well, through the last 4 years ago, when I first came to the legislature, of course, we had a series of Columbine and Parkland and Sandy Hook and Gabby Giffords and other incidents that had happened. And all of these instances were people who had repeatedly threatened to kill other people, and law enforcement couldn't do anything. So I think one of the things I dedicated myself to down here was for this, and I've been working on it 4 years. Originally, there was a law in, I believe, Washington State that I found very interesting, that was passed muster. It passed federal courts. It was put in place by the legislature there to deal with this. But I copied that and gave it to our legal department to base it on. But their law went far, far beyond where I wanted to go. We already have many things in code that we didn't need to do. And it was just a total rewrite. I think it was Marcy's law or Stacy's law. It was out in Washington State. And after that first year, which I never ran a bill, we were still writing it. Then my attorney at legal retired, so I had to start over again the next year. We determined that was not the bill that we needed to do. So we started looking around, and we found bits and pieces from New York, which goes far beyond ours as well. And matter of fact, legal originally based this, when I had original early concept, they originally based this on New York law, which again went way beyond what I wanted to do. And they gave it a $17 million physical note. And I said, no, I don't want to do these things. So we redefined it and got it down and worked with fiscal review and got that down to this $500,000. And like I said, it's currently in 14 counties that would have a mental health court, and hopefully we can expand it later. There are other states that have since during that time, like Alabama, I believe Mississippi, have passed similar bills, but not exactly like this. And working with the national mental health advocates that have also commented on this over the years and actually flown in and helped, they said that this is the best bill of any they've seen in the state. It's a clean bill. It doesn't totally rewrite the mental health law. It addresses just the violent mentally ill that repeatedly threaten to kill people. Originally, everybody wanted it to also include oneself. If you threaten to kill yourself, that's what I'm after. I'm trying to avoid mass killings. And I'm not after suicides. There's already laws on the books for suicide. And I also don't want to go after if a neighbor gets in a dispute over a hedge and makes a statement, I'm going to kill you. That's why repeatedly it's in here. We don't want to capture anybody. That's also why the physical note is lower. They do not expect this to affect a lot of people. And as these groups have called out, the 2 pilot programs only produce 1 person. So I think it'll be well under 10 people a year, probably under 5 people a year that this will affect.
Chairman Vaughn.
So I'm taking that as this is an original work, that this is not modeled The original question was this model in other states that's been put in practice? And that's not the case with this law.
It's similar. Both bills that have been written after this one and before this one, we've looked at them and see how effective they are and took pieces of it, but no, it's not modeled after any one.
Okay.
That's why the mental health advocates, national mental health advocates, they've said that they really have said that this is the best bill they've ever seen that deals with this situation.
Thank you.
Speaker Marsh, recognized.
Thank you, Mr. Chairman. And Chairman Rudd, I've had several people and groups come to talk to me about this bill, and I do have some concerns with it. And I know we've got a fellow here today who's going to testify. But I wanted to ask you, the mental health court judges, have you talked with any of them, and are they for it or against this legislation?
Chairman, you're recognized.
I have not talked to every mental health court judge. I've talked to like Barry Tidwell, the mental health court judge in Murfreesboro, which has a mental health court, and he has advised on it. And he has reached out to other mental health court judges during this 3-year process that I first went to him, and none of them have expressed any negative about this at all. That the tool it would give them. The only question I had was after the people that are going to testify today falsely claimed to them that the recovery courts would be burdened with a flood of people, which is not true. They called and said, "Has this bill changed from what we talked about?" And I said, "No, it has not." So they were led to believe that it would. Even they were calling me saying that this is going to be everybody that attempts suicide. This does not concern suicide.
Speaker Marsh.
Thank you. And I want to ask a couple more. Is it the Department of Mental Health? Have they agreed that this is a good bill? And I also want to ask how many mental health groups or associations in Tennessee have spoken up in favor of this piece of legislation?
As Chairman Marsh, as I said earlier, no mental health group in Tennessee has endorsed this. As of before last week, none had denounced it. The ones that have been in my office, since this bill is the same as last year, except for the bombing, that one little sentence that's been put in for mass acts of violence, they said they were deferred on it when they've been in my office before.
Chairman
Is
Marsh.
the Department of Mental Health signed off on it?
The Department of Mental Health is not promoting it, but they were comfortable with it and said they deferred on it after I made changes and worked with me over the last 2 years to adapt to what they wanted. They actually helped write parts of this bill to get it to where they were happy with it, and they have deferred on it.
Thank you.
Before we go to our next speaker, I just wanted to clarify something. You did speak to Judge Tidwell, and is he supportive or is he neutral or?
To my knowledge, he's supportive of it. And he, when I first, 3 years ago, when I first called him and involved him, I got advice from him and read him what I was doing and have sent copies through the last 3 years to it. I spoke to him just the other day.
All right, thank you. Representative Clemens, you're recognized.
Thank you, Mr. Chairman, and thank you, sponsor. To the extent you're seeking to ensure public safety, I appreciate the spirit of this legislation. To that extent, I think what you've done is made a compelling argument here today for red flag laws. To that end, I applaud you as well. But as you admitted, there's a process in place to do this currently under state law, and it was, to the best of my knowledge and experience with it, it was carefully designed to ensure individual rights and liberty. And so that leads to my other concern. And also you addressed the issue of threats to public officials or congressmen, such things like that. I think you mentioned, of course, there are laws to address that as well, and criminal laws to prosecute those individuals if legitimate threats are made. But getting back to my point about the current laws on the books, the system to do that is a civil law process and goes through civil courts in most counties. I know it does here in Metro. And our mental health court is a criminal court in general sessions. And so my concern, and I think a concern of some judges, at least the ones with whom I've spoken, is that we're taking something out of the civil process and putting it into the criminal courts. And the mental health courts that are within that criminal court system are not equipped to handle the civil matters. I think they want them staying in the same. I don't know why we would want to cross over from civil to criminal. is a big concern of mine. And I'm not sure our mental health courts, at least the ones from whom I've heard, are excited about that and certainly have concerns about that issue. So if you want to respond to that, I appreciate it. And thank you, Mr. Chairman.
Chairman Rudd?
Well, the reason why civil courts have failed to deal with this all over the country is because once they've committed an act of violence and killed people, it becomes a criminal matter. And the judges that deal with actual criminals that commit violence is the mental health court judges, or in counties where there is no mental health court judges, it could be a chancellor or another judge. So they are the only courts that specifically are trained to deal with the violent mentally ill, and potentially someone who would be mentally disturbed to the point that they would be a threat to others. Most mentally ill people are not a threat to others, and many are not even a threat to themselves, but they're more of a threat to themselves than they are to the public. And this is in no way, of course, aimed at them. This is aimed at the violent mentally ill that could kill people. And I'm trying to head that off. And I don't feel a civil court would really be qualified to deal with the violent mentally ill, the criminally mentally ill, and criminally insane almost, as you could say. And also, as I said earlier, it's very, very cumbersome on a family member at their own expense to take someone to civil court and try to get them into treatment at their own expense. Most families can't afford that, and that's why the system fails.
Representative Clemens?
Yeah, thank you. And I appreciate that response, but I think there's a very fine distinction here. And I think there are courts, civil courts, that are very well equipped to deal with this. I mean, these same courts handle conservatorships. And mental illness or disability is mental illness or disability, regardless of the result. And if somebody makes a threat or commits a criminal act, then they belong in criminal court. But until that time, we're still dealing with someone who may be mentally disabled or incapacitated in some respect. And in that instance, until they have committed a criminal act, they don't belong in the criminal system. And so we already have courts in the civil system to deal with precisely this issue. And again, the process is in place. You may fairly characterize it as too cumbersome or too difficult. And to address that specific issue may be a worthwhile endeavor and try to simplify that process. I don't know. But that process exists, and it's designed carefully to protect the individual rights and liberties of individuals and not discriminate against anyone or shift them into a criminal system simply because they have a mental illness or disability. That is a very fine line. And I think it's very important for us to keep the system intact as it is. Now, improving that system is certainly, again, an option. But now here we're creating an entirely new one, as you responded to a previous questioner, and that creates multiple issues. So thank you for listening to my concerns, and thank you, Mr. Chairman.
Chairman Rudd?
I respect the rights of the mentally ill, and we've gone overboard here to make this a private process unless you appeal. If you want to appeal the judge's decision, you can have a court-appointed attorney represent you if you can't afford one. And again, this is private, so we're trying to protect them. I think we reach a point in any society, is the rights of an individual greater than the threat and the rights of the victims and their families? Is someone that needs help going to be inconvenienced to get that help versus telling a family member that their loved ones have been killed in a plaza or a stadium or an arena or in a parking lot or at a picnic or any other event of mass act of violence? So at some point we have to say we've got to, at the best we can, protect the rights of the violent mentally ill, but we also have to protect the rights of families and victims and potential families and victims. And that's what this bill does.
Representative Smith, you recognize.
Thank you, Mr. Chairman. And sponsor, one of the things that I've heard from is my county sheriff's department. And his comments to me were that at any given day, 26 to 40% of our local county census in the jail are those who are mentally ill. And so one of the things that I do see is while these may not be individuals that need to be certified, and taken into court in state custody. I do appreciate the fact that we need this. If you wouldn't mind, relative to the scope of this bill, is it your belief, or maybe this is a question for legal, that if your bill doesn't pass, is the only remedy for someone to be certified and to put into state custody or to be arrested? Is that what are the current pathways now, absent your bill, for individuals who pose a threat? Because clearly, the way this is written, this is directed toward a population of people that are posing some type of threat to the public and or themselves. But what are the current pathways? Is it certification to become a ward of the state currently, or a criminal? If you wouldn't mind elaborating on that. Thank you, Mr. Chairman.
Representative Smith, it varies greatly, as I've pointed out, that one of the processes that was just pointed out is to take a relative to civil court and try to have a judge do what this is doing. That is a very lengthy process, and it's an expensive process to the family members that are trying to do it. During that year to year and a half, or even up to 2 years, or it could go through several months, and then lack of funds, they drop it. Someone could get killed, and the person would never get help till it was too late. As far as police, if you're threatening to kill people to the police, they have actions that can take. It's still not an easy way that police can get someone into treatment. They can investigate them. They can go to them. And even during this process, if a family member has threatened and said that my son is threatening to kill all these classmates over and over again, I'm afraid that he's going to harm someone, they could tell the police comes to the house, and he could act perfectly normal and deny saying that. And that's going to be, the police is going to have to evaluate the situation at that point, or the family member can still petition to the judge. And the judge, of course, would also take in the testimony of the investigating officer when he decides whether the person should be evaluated. But there is not a lot of pathways, nor is there in most states. That's why in almost every state where there's been an act of mass violence, the police were called by family members or coworkers. They were told that they continually threatened to kill other people. The police investigated, but they did not have this law. So there's nothing they could do when they go to a judge and the person acts perfectly normal in front of them. They say there's nothing I can do until they've committed an act of violence. It's very hard to bring a person like this. And depending on who evaluates them at below a psychiatrist level, it could be a volunteer. It could be somebody in a clinic. They may deem them, even though they may not be professionally trained, they may evaluate them as just fine, just upset or depressed. So we need to have these people evaluated, and the psychiatrist could very well say, he's depressed, he's not a threat to others. He just needs to have maybe some further counseling. So they could dismiss it. But to answer your question, there really is in Tennessee, there are very, very few options for authorities or immediate family members that are not cumbersome, lengthy, and expensive.
Representative Smith, you're good. Representative Mitchell, you recognize. All right. Without objection, the question has been called. All those in favor of House Bill 502, say aye. Those opposed?
No.
House Bill 502 fails. All right, that brings us to item number 5, House Bill 13. Without objection, I've spoken with the sponsor of that bill. We are going to roll that to the heel of the calendar without objection, and I will probably call that up back out of order here shortly. Without objection. That brings us to item number 6, House Joint Resolution number 10. You have a second? You have a motion, a second. You're recognized.
Thank you, Mr. Chair. Mr. Chair, recently the American Medical Association recognized racism as a public health threat. And what this resolution does is just resolves that. American Medical Association recognizes racism as a public health threat. And I was trying not to bore everybody and read the resolution, but if the members want me to read the resolution, I'd be happy to.
Any questions from the committee on the resolution? Vice Chair Leatherwood, you're recognized.
Yeah, I did read it over, and thank you for not reading the whole resolution. All of the whereas clauses, they do deal with the AMA and frankly, some of their past actions and maybe the founder of the AMA and so forth. But generally in any of these resolutions, to me, the most important thing isn't the whereas, but the resolved clause, which we recognize racism and public health threat and commit ourselves to openly and honestly addressing racism to end areas of disparity and inequity. And I would say, in my mind, racism absolutely does exist in the hearts of people. We are all sinful and fall short of the glory of God. And until people can recognize that we are all made in the image of God, you know, there will still be some level of racism there. But before, as the resolve clause says, I commit myself to something, especially addressing areas of disparity and equity, I wonder what your thoughts are on in Tennessee, since we are Tennessee, we're not the AMA. You know, what are the areas of disparity and inequity, and how are we going to commit ourselves to address these areas?
You're recognized.
Thank you, Mr. Chair. And to my colleague from Shelby County, thank you for that question. We're already working in areas of improving healthcare gaps or reducing healthcare gaps in areas. There was a study done by the Robert Woods Johnson Foundation that showed where healthcare was not being distributed evenly, so to speak. And I'll give you an example. You know, in communities of minority communities, there are minority communities lead our state in areas such as high blood pressure, congestive heart failure, all of these things that would kill you. And then, as a matter of fact, it was evidenced through the COVID, through this pandemic, because a lot of the individuals that died were dying because they had pre-existing conditions that when COVID attached, it would kill them. A lot of those individuals were people of color and people from high-risk communities. And what this is saying is that we're going to do everything we can to address those areas, address those gaps. And let me be clear. We've already started doing that. The governor has created or appointed Dr. Lamar as who supports this legislation also as the person over minority health under the Tennessee Health Department. And they are working on good policy and initiatives to close those gaps. And so that's all this is saying, is that this thing does exist, whether intentional or not, right? It does exist. And we're going to resolve, and it's not a law. So we're not putting, it's not a law, it's a resolution that we're going to work hard to close those gaps in those disparities.
Chairman Williams, recognized.
Yeah, thank you for the resolution. I just had one. I think it's really important. The words matter, and so one of the questions, or one of the things on whereases, as someone said, was structural and legalized system that results in differential access to goods and services. I guess if you could share with us or the body maybe an example of what that is in Tennessee, as previously stated, what would be a structural or legalized system that results in differential access to goods and services?
Yes, sir. So thank you for asking that, Chairman Williams. During that Robert Woods Johnson study, one of my district hospital, Methodist North, they decided to allow themselves to be part of the study. which was rare. You know, you rarely see an institution like that volunteering to see if they have challenges in applying the same medical treatment to every individual evenly. And out of that study, they found that there were some areas, you know, that they had to improve on. And I applauded them for that. Now, this has been a few years ago. I applauded them for that. And now they are one of the highest recognized hospitals in our state. And I think out of that, I forgot the name of the award that, and maybe somebody that's in the medical profession can tell me what the name of that award is for hospitals that are at the top tier, you know, for you know, policy, the how they treat patients and you know, and care. But they've made it to that since then by making those improvements and the things that came out in the Robert Woods Johnson study. And so that's kind of what we're talking about.
You recognize Chairman William?
And I recognize that study was 3 years ago,
right?
It
was.
So.
Yes,
and so I think one of the things that that I think is really important is that we just don't resolve to pass resolutions. We resolve to pass bills to effectuate change. The reason why I think it's important to ask the question, what are the structural, what are the policies that we can change? So I think this body and legislatures previously want to make changes if there are structural or systemic changes that are codified in the statute, which impugns any group.
Absolutely.
And so that was the reason by the question. I recognize you might not have the answer to the actual structural part of it because the study was a few years ago. But I think it's important that if we're going to say there is a structural problem, we need to fix the structural problem and isolate what that is.
Right.
You recognize.
And very good point, Chairman Williams. And to your point, sometimes structural issues may not necessarily be codified in law all the time, but they may be in policy or lack of policy. For example, for the governor, I don't know if it was under Governor Bill Lee, the creation of the Department of you know, Minority and Disparity that falls under the Health Department. I don't know if it was Governor Lee or Governor Haslam, but whoever created it, and the fact that Governor Lee is still funding it and supporting it, that shows where there was a structural issue, because minority communities deal with health challenges that more, in some cases, than what other communities more affluent communities may deal with. That makes sense. So in creating the Minority Health and Disparity Division of our state health department, fix one of those structural issues to address the disparities and close the gaps and make sure that everyone is receiving the quality care that they need from our, you know, in regards to our state.
Right. Thank you. Speaker Marsh, you recognize. Okay. Question has been called on House Joint Resolution 10. Without objection, all those in favor say aye. Aye. Opposed? Okay. Ayes have it. Resolution goes on to calendar and rules. If you would like to be recorded as a no, please notify the clerk. Goes on to calendar and rules. I think. All right, that brings us to item number 7. House Bill 743. Chairman Vaughn, you recognize.
I don't know. I couldn't tell.
Thank you, Chairman.
Okay, I need a motion. Okay, you have a motion, second.
Thank you. Ladies and gentlemen of the committee, what House Bill 743 does, seeks to allow physician's assistants and advanced practice nurses to be able to write orders for people to be able to go to home health care or have home health care directed to them so that they're not having to have an office visit with a doctor, whichever provider that they have coming to their home, they can write the orders for the home health services.
Okay. Any questions on House Bill 743? See none. We are voting on House Bill 743. All those in favor say aye.
Aye.
Opposed? Bill goes on to calendar and rules. That brings us to item number 8, House Bill 1076. Vice Chair Leatherwood, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman and committee. House Bill 1076, it just removes a provision that requires a physical therapist who graduates with a doctorate wait for 1 year before they can fully take advantage of all provisions in the Practice Act. And this just cleans up an omission from a more comprehensive bill from last year.
Okay. All right. Question has been called on House Bill 1076. Without objection, all those in favor say aye. Opposed? Ayes have it. Your bill goes on to calendar and rules.
Thank you.
That brings us to your next bill, item number 9, House Bill 1275. Vice Chair Leatherwood, you are recognized.
Thank you, Mr.
You have a motion
Chairman.
second.
Committee. This bill updates the occupational therapy and physical therapy practices to include telehealth and telemedicine. And this also authorizes dry needling as part of occupational therapists' scope of practice to be formed exclusively with them on the upper arms, upper limbs.
Any questions for the sponsor of the bill? Okay. Seeing none, we will be voting on House Bill 1275. All those in favor say aye.
Aye.
Opposed? Ayes have it. House Bill 1275 goes on to calendar and rules.
Thank you.
So if the committee will indulge me for 1 second here, without objection, we are going to pull up from the hill of the calendar House Bill 768 by Leader Lamberth, and Chairman Littleton is carrying that. So without objection, we're on your bill. You have a motion and a second.
Thank you, Mr. Chairman. This bill will make significant revisions to the child care quality rating improvement system, the mechanisms for conducting quality assessment of child care providers, the child care report card system, and the child care rated licensing systems. The new assessment system will replace the current outdated report card system. DHS has developed an assessment tool to weave the quality and assessment indicators into the licensing rules so that it is a seamless system for parents and providers to navigate.
Any questions on House Bill 768? Okay, Representative Clemens, you are recognized.
Thank you, Mr. Chairman. Thank you, sponsor. My question was simply, I know it's adjusting the fee schedule for the licensing of the child care agencies. Is it increasing fees in any way?
Chairman Littleton?
I don't think so.
That's my sole concern, whether or not we're increasing fees, Mr. Chairman.
I haven't been asked.
Okay. It does not?
It does not.
It does not. Okay. Chairman Williams, you recognize?
Just to follow up from Representative from Davidson County's question, the fiscal note says that it decreases state revenue. It's my understanding that this bill actually decreases the fees on this, but I don't know if there's anyone else who can testify, but I'm pretty sure it is. I'm getting the nod over in the corner.
Decreases fees. Okay. Chairman Littleton?
It does. You're correct.
Okay.
Thank you.
Thank you. Any further questions on House Bill 768? Okay. Seeing none, we are voting on House Bill 768. All those in favor say aye. Aye. Opposed? Ayes have it. Let's see. What is it? Okay. Bill goes on to government operations.
Thank you, Mr. Chairman and committee.
Right, that brings us to item number 10 on our calendar, House Bill 80. Chairman Kumar, you're recognized. You have a motion, a second.
Thank you, Mr. Chairman. House Bill 80 is an administration bill about the controlled substances database, and it makes certain changes to facilitate transmission of data. This data is very critical because we use it to monitor the use of controlled substances such as opioids. And in the past, the data has been submitted as an aggregate, but to make it more useful to these facilities, it is now, with this bill, will be submitted in a line item, but it will be de-identified in a careful way so the confidentiality is maintained. The data will be shared with other states, state agencies, as well as agencies within the states, including medical examiners in various counties. I'll be happy to answer any questions.
Any questions on House Bill 80? Seeing none, we will be voting on House Bill number 80. All those in favor say aye. Aye. Opposed? Bill goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
That All right, that brings us to item number 11, House Bill 508. Chairman Boyd, you're recognized. You have a motion, second.
Thank you, Mr. Chairman. House Bill 508 simply allows pre-licensed graduate or doctorate level professionals under Title 63. So that would be your audiology, speech language pathology, mental or behavioral health industries, any of those individuals to use telemedicine to obtain their practicum or internship hours. I'll take any questions, Mr. Chairman.
And I believe there is an amendment. Is that correct?
There is an amendment. I apologize. It makes very minor technical changes, and the drafting code on that is 2221.
Second.
No, I apologize. It's
003746.
I've got 003746.
Okay, you have a motion, a second. So let's go ahead and get that on the bill. All those in favor say aye. Aye. Opposed? Ayes have it. Okay, we are back on the bill as amended.
Thank you, Mr. Chairman. I'll take any questions.
Any questions on House Bill 508? Seeing none, we will be voting on House Bill 508. All those in favor say aye. Aye. All those opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Chairman and committee.
All right, thank you. So without objection, I'm going to go to the heel of the calendar and pull up House Bill 13. Representative Halsey, you are recognized. Hold on just one second here. Okay, so reminder to all the committee members to the posture that we were in when we rolled the bill. We have adopted Amendment 003720, and we were debating the Amendment 4084. It had a motion and a second. So at this point, that is Chairman Kumar's amendment, and Chairman Kumar, you will be recognized.
Thank you, Mr. Chairman. I move to withdraw.
Okay. Without objection, Amendment 004084 has been withdrawn. Okay, that brings us to Amendment 004157. Yeah. Do you want to run that? Okay. All right. Without objection, that has been withdrawn. That brings us to Amendment 4462. Chairman Ramsey, do you wish to run or withdraw?
Thank you, Mr. Chairman. I wish to withdraw.
Okay. Without objection, we are withdrawing 4462. That also, we have another amendment, 4534.
Move this amendment to the Hill, Mr. Chairman.
Before we move that to the Hill, I'm going to need a motion for a second. Okay. Without objection, we will roll that to the Hill. Okay. That, I'm going to have to pass the gavel on this for the next amendment.
Chairman Terry, you're recognized on Amendment 4574, drafting code. There's a motion and a second.
All right. Thank you, Chairman and committee. And even though I like this bill in its original form, it's should be obvious to the sponsor and those at home that the committee is not in favor of the original language. I have worked with others and the member who brought this and offering this amendment. One of the major concerns of the sponsor is that he brought forth is the fear and concern, particular as it relates to a non-fully approved or a vaccine that is under emergency use authorization. And while I may not believe that the state could require that type of vaccine, the amendment makes it clear that the state cannot require any COVID-19 vaccine that is not fully approved or still operating under emergency use authorization. And the amendment also removes the words force and coerce from the original bill. So with that, I move adoption. Or open for questions.
Any questions? Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. The question would be that we will not ask anybody to take this vaccination against their will if the treatment has not received final approval outside emergency use. So if it is a emergency use authorization has been granted by the FDA, they can be required to?
Chairman Terry, you recognize.
They cannot be required if it's emergency use authorization. It's only if it's been fully approved.
Well, that's really worrisome in the sense that full approval of a vaccine, the kind that we're using now, could take several years. And considering the loss of life and considering, I mean, it would be unconscionable to wait for 2 years before approving this vaccine, considering the loss of life that has already occurred, 500,000 people, or how long will we wait? I'm really surprised at that. And I don't think that would be acceptable to most people. Thank you, Mr. Chairman.
Thank you. It's,
would you like to respond?
Thank you. Again, I think that the way, I know we could talk to legal on this, but my understanding is though, even though it is not fully FDA approved, that would still, it's under emergency use authorization, it's still undergoing trials, and that I think that they would not be able to require that anyway.
Representative Mitchell, you're recognized.
Yeah, thank you. Yeah, and Chairman Terry, I appreciate you trying to make this bill better, but I'm still back to the point I was last week where I think right now we don't need this bill because we're at the point in time right now, no one's going to force anyone to take this vaccination. But if we get to the situation where we have to, because as Dr. Kumar said, the loss of life becomes so significant, I just hate that we're handcuffing ourselves, especially when we're living in the fourth most infectious state in this country during this pandemic already. You know, I just hate for us to handcuff ourselves in a situation where we've got to do something immediately to save lives. And no one's going to force anybody to take this shot right now. And, you know, a lot of people are glad people are not getting in the way of them to get it. For the folks who don't want to take it, there's plenty in my community that want the vaccine, and they're glad you're getting out of their way. Thank you.
You want to respond? Chairman Vaughn, you're recognized.
Thank you, sir. My question is for the amendment sponsor, Dr. Terry. And I apologize because my battery power is running low and I can't pull up the amendment. Does your amendment exclude healthcare facilities like Amendment 1 did?
Chairman Terry, you're recognized.
Thank you. It does not carve them out in that language. No, it does not.
Thank you, sir.
Representative Smith, you're recognized.
Thank you, Mr. Chairman. And this question is directed to the bill sponsor. There's quite a few amendments on here, and I think we've all kind of been in committees today. Where do you stand on this particular amendment? Thank you, Mr. Chairman.
Thank you, and I appreciate your patience and all the time you're spending on this with me. I really do. Thank you. The chairman's amendment's got a time limit on it. It expires when the FDA approves it. I don't like that part of it. Dr. Kumar's new amendment, I think, fits with my original bill pretty well. And I view that as a friendly amendment. I do view the chairman's amendment as trying to help get through this. It's just that it does have an expiration date on it.
Representative Smith, do you have a follow-up or anything? Okay. Next, we back to Chairman Kumar.
Oh, thank you. I would really like to note that I think we as leaders in our state, as elected representatives in our state, need to be very careful in calling this, the COVID vaccination, experimental or unapproved, because it could sway some people who actually will benefit from it, who will need it, and considering that more than 30+ million have been vaccinated, the safety has been proven. It could sway somebody not to take it, and we would be doing harm in doing that. I'm really concerned, and I don't think we should be doing that. These are difficult times. None of us in our lifetime has ever seen a pandemic. And we know the virus came out of China, where there are questions and doubts about how it got out and what was done. There are concerns. We could be facing during our lifetime, God forbid we don't, we could be facing a Bioterrorism Act. Yes. During those times, we pray for good leaders, and we would want our leaders to have the tools that they need. And I think by doing this, we are creating a negative feel between the government and us. We are creating a negative feel towards vaccination. And let us, gentlemen and ladies, let's be careful. We really need to worry about things that are happening and what the future of our nation is. And as I said, during bioterrorism, something like that, we don't need that feeling. I mean, I pray that we will all bind together and hold hands together and get through difficult times. Thank you, Mr. Chairman.
Thank you. And Representative Williams, Chairman Williams, you're recognized.
Thank you. For the amendment sponsor, I guess the question is that your amendment states that you couldn't require anyone to do this prior to full FDA approval, and then after FDA approval, entities could in fact require them to do it then there has FDA approval?
Chairman Terry, you're recognized.
Thank you. I'm not sure I understand until it is fully approved, they cannot require it, and it does not prohibit them afterwards. Again, I like the original bill as it's written without any amendments, but again, one of the concerns was the fear that's out there that people are going to have require a vaccine that has not gone through full approval and is still under emergency use authorization. And that's simply what the amendment does.
Chairman Williams, you're recognized.
Thank you. And I realize that it's late in the day and we've all been in committees all day. So just to clarify again, after FDA approval is obtained, anyone can require someone to take an approved vaccine.
It does not.
Representative Chairman Terry, you're recognized.
Thank you. It does not prohibit that.
Okay.
Now, that being said, it may not be required at that time. It may not meet the necessity. And we have other things that would be reasonable means to protect patients with PPE. Thank you.
Representative Freeman, you're recognized.
Thank you. And I'm going to use the same term everybody is. It's late in the day. We've been in committees. I'm not totally sure what posture this is in. So we passed an amendment in the committee, right? And that amendment has now been taken off. So the first amendment that passed that excluded hospitals is still on the bill, and this is a new amendment to the other.
Chairman Terry, you're recognized.
Thank you. Yes, the amendment that we currently passed last week is still on the bill. This would rewrite the language and rewrite the bill.
Representative Freeman, you're recognized.
Thank you. This is now the third day. We've had 5 amendments. This is clearly a complicated issue. And I'd like to make a motion to send this to summer study.
We got to vote on the amendment.
Okay. Representative Freeman, as I understand, we have to make a decision, dispose of this amendment first, and then that's a motion that you can make on the bill itself when we get to that point. So at this point, that's not a proper motion. Thank you. Representative Clemens, you're recognized.
Thank you, Mr. Vice Chairman, and thank you, Chairman, for your work on this legislation and attempt to find a compromise. And thank you to the sponsor of the original bill. I don't think you should apologize for taking up time of the committee on this. This is a serious matter that affects the public welfare and general well-being of every Tennessean. I think this is precisely why we're here. And I think the individual rights and liberties of Tennesseans are important to every one of us. And so we're looking at an issue where we're weighing weighing these issues with the public welfare. And it's a good debate. It is an academic exercise that I think is worthwhile. And both are equally important. And so people are going to have a tough decision to make. And that's why I appreciate the amendment and the work that's attempt to find a compromise. Now, this question is going to sound odd, but Mr. Sponsor, Chairman Terry, is the new variant or new variants of SARS-CoV-2 referred to as COVID-19 or something else?
That would be something we need to clarify with legal.
I need to
repeat.
Do I need to repeat?
Yes, please.
SARS-CoV-2, the new variants that have emerged recently, are they referred to as COVID-19? Or are they COVID 20 or 21?
And is that addressed to legal or to the sponsor or either?
I was directed to legal. I'm not running.
Okay, without objection, we'll go out of session to hear from legal, and you're recognized.
Matt King from the Office of Legal Services. Representative Clemens, as the amendment is written, it only speaks to COVID-19. And I personally do not know whether or not they are referring to it as something else. However, we refer to it only as COVID-19. We don't define it any other way. And so it would be based upon just a plain reading of the reference to the COVID-19 immunization or vaccination.
Thank you for that. We can go back into session. I don't have anything further.
Okay, then without objection, we'll go back in session, and I do have a couple more people on the list. Chairman Hall, you're recognized.
Thank you, Mr. Vice Chair. Sponsor, I appreciate you bringing the bill. I like it in its original form. You know, I've always thought that amendments are a way to hijack your bill, to water it down, to whittle it away to where it loses its form, where it's never it doesn't end up in the same place that it started. But for those that are lost in the translation, let me just say this: and I'm not trying to oversimplify it, but it's basically this simple. You've got a small group of people that want to impose their will on the masses, or a large group of people. And basically these masses want to be left alone. It's sad that we have to draft legislation to be left alone. I don't know. Normally when you impose your will on someone that wants to be left alone, you can get arrested. And if we was talking about anything other than vaccine, that would be what would be taking place today. Now, we opened this session up with saying the phrase with liberty and justice for all. And that would apply to those that doesn't want the vaccine. Mr. Chairman, that's all I have. Thank you.
Thank you. Next, we have Chairman Kumar.
Thank you, Mr. Chairman. I'm confused. I don't think we have the correct interpretation of Amendment 4574 in the sense it clearly says an individual will not be required to receive an immunization or vaccination for COVID-15 against their will if the treatment has not received final approval. So that means if final approval has been granted, then they will be required. I would like legal clarification about it. If the vaccination has been approved, then they can be required to take it. That's the interpretation it reads. Kindly have legal clarify it.
Without objection, we'll go out of session to hear from legal.
Chairman Kumar, I'm sorry, I was speaking, can you repeat your question? I apologize.
The question was asked before that it reads that a person will be not required to take vaccination against their will if the treatment has not received final approval. That implies that if the treatment has received final approval, then they can be required to.
That's correct. That's correct interpretation.
Okay, so they will be required to if it has received final approval. I think it was answered incorrectly.
You're recognized.
Just to clarify a little bit further, Chairman Kumar, the interpretation I understood you to have was that if the vaccine for COVID-19 were to receive final approval, state or local government could then require the vaccine. However, if it got final approval, it's not automatically required. We would just be back in the posture that we are in today with state and local government's authority to take such an action.
Thank you.
Okay, we will go back out of session, go back into session.
Yeah, thank you, Mr. Vice Chairman. And I appreciate what the previous representative said about everyone's liberty and their rights. But your rights kind of end when you're endangering other people. When a small group of people can endanger the rest of us in society, you have to act sometimes. And again, we're doing all sorts of gymnastics with amendments, trying to figure out something we don't need to fix, because currently no one's being asked or forced to take this vaccination. But if we get in a situation where we have to, for the public health demands it, they probably will be. But do we really want to get to the point where if we pass this, we can't do that to protect the masses because a small group of people want to endanger most of society? So I just think we're doing somersaults here and trying to fix something we don't need to fix. Leave well enough alone. Thank you.
Thank you. Any other questions on the bill? Chairman Terry to close. On the amendment, sorry. Representative Hulsey, you're.
Thank you. Just at some point, if you can tell me where we're at and what amendments are still on it and which ones aren't, I don't know what to agree or disagree with because I don't know where I am.
Yes, sir. I understand how these things happen. It's Wednesday, March 10th. You're in the Health Committee hearing room presenting your bill. We have one amendment on the bill. We are discussing an amendment from Chairman Terry, which if it goes on, it would rewrite the bill. Without any objection, he said he did not before. You okay? Without any objection, then we'll call the question on the bill. Do you have a question? Oh, I'm sorry. We have another question on the amendment. Later again, you're recognized.
Thank you, Mr. Chairman. Dr. Terry, if you can help me by just real quickly summarize what your amendment does real quickly. I'm sorry to do this, but I'm lost and I need to get in the right frame of mind here.
Chairman Terry, you're recognized.
Thank you. What it would do currently, as the bill is written, we have an amendment on the bill. It would rewrite the bill, so it would strip that amendment off, and it would put in place that the state or local governments, they could not require a COVID-19 vaccine that has not gone through full approval or is still under emergency use authorization. At the moment that it does become fully approved and it's no longer emergency use authorization, it no longer prohibits that.
Follow up? No, you're good. Okay, any other questions? If not, then Representative
Chairman Kumar's new amendment, is that in this package at all, or where does that fit?
It is, but we need to focus on the amendment before us at this point. Go ahead and get this resolved. And so without objection, question on the bill. Amendment. I will get that right. All right. Ready? All those in favor of Amendment 4574 drafting code indicate by saying aye. Aye. All those opposed indicate by saying no. No. The noes have it. Okay. That amendment fails, which I guess at this point, turn it back over.
All right, thank you. That puts us back in the posture that we were in. We still have Amendment 3720 is on the bill. We have rolled Amendment 4534 to the heel. we are, Chairman Williams, you're recognized.
Sorry, I just had a question. Before we go off the rails too far, I would like to ask legal if they could tell me I think we're to the amendment that's on the Hill, I think now. And so, but the amendment that was filed by Chairman Ramsey, that he moved to withdraw, the question to legal would be, in order for the bill to be made whole, with that amendment, would we need to reconsider our actions to fix the hospital portion of it with Chairman Ramsey's amendment prior to adoption to Kumar's, or if we took Kumar's, or do we need to take Kumar's first? If so, I'd like to make a motion to reconsider our actions on move for withdrawal of Chairman Ramsey's amendment. That's a lot, but.
So for clarification, your motion is to reconsider our action on withdrawing amendment 4462. Is that correct? Yes. Okay. Without objection? Okay. Okay, without objection, we'll be voting to reconsider our action on 4462. All those in favor say aye.
Aye.
Opposed? Okay, ayes have it. If you wish to be considered a no, notify the clerk. We are
We are reconsidering it. We are reconsidering it.
okay. So we are on amendment 4462. Need a motion, a second.
Second.
Okay. You're recognized. Chairman.
This, originally in the subcommittee, when we were considering the original bill by Chairman Hulsey, we were notified that this bill mentions in state institutions under titles, hospitals essentially, under Title 68 and 33. That's about 45 hospitals across the state, which one is in my district. I had a request from the Tennessee Hospital Association as well as my hospital, a government hospital in the district, to exclude these hospitals. So this amendment is stated in the number 4462 does that, eliminates those hospitals, government hospitals under 68 and 33. And we had originally put this on in the subcommittee, but my understanding was that the Chairman Terry's amendment, were it to pass, would satisfy the need to exclude those hospitals, and it did not pass. So I'm still under obligation to my hospital and the other 45 to exclude them.
Any questions on the amendment? Seeing none, we are voting on amendment 4462. All those in favor say aye.
Aye.
Opposed? Ayes have it. We are on House Bill 13 as amended. Unfortunately, we are at the end of our time. So without objection, I hate to do this to you, but we're going to roll you in this posture to next week, and you will be first on the calendar. Thank you. Without objection, rolled next week. Seeing no further business before us, we are adjourned.